Have you ever transfused blood? Have you wondered if it's safe or not? Do you know where you got it from? These are the questions we'll discuss in this video. My name is Ghazi Ali Raza, this is MedScenarios, and today we'll be talking about transfusion of safe blood. Among the different biological interventions, one key intervention to prevent HIV is transfusion of safe blood. Let's say a patient comes in to the hospital. They have never been exposed to HIV. They might have had an accident or any condition that made them come to the hospital. You want to transfuse blood that is safe to them so that they're not exposed to HIV. You don't want to get blood from a HIV donor and give it to the patient. So let's discuss about donor selection, pre-donation counseling, clinical assessment, blood testing, post-donation counseling, and safe and appropriate use of blood and blood products. To start with, let's talk about donor selection. I don't know if you guys have been to our blood donation camp. Do you know how they select donors? The donors should be voluntary individuals who want to give blood. You need to explain them what the cause for this blood donation would be and how it will help save lives. But you also need to make sure that these donors are not remunerated in the sense that they're not paid for giving blood. You don't want to start saying people that will pay you for your blood. That's not ethically appropriate. But what you could do is you could talk to these volunteers to show the human cause of donating blood to save a life. That's the most important bit. These individuals should be at a low risk of having HIV. You have seen in our previous videos how you can assess for risk for HIV. You can screen these donors, and usually in Uganda here we have these health cards for blood donors where they have to fill up information, and it's basically a screening tool which shows the different categories that can be used to exclude people who are at high risk. And this patient should be also healthy. You don't want to get someone who is sick. They have other conditions, maybe not a communicable disease, but these conditions make them vulnerable to having morbidity and mortality. So you should make sure that these people are healthy and they're also safe, and also between the age of 17 and 65. You don't want someone who is in their old age, 80s and 90s, whose immune system is already dropping down and they're weak, and you don't want to take blood out of them. They have to be in an age group in which the bone marrow is actively producing blood, but also not below 17, because they have to be able to consent for their blood from their body to be used. Remember, the major thing when it comes to donor selection, you want to retain them so that they can come and donate again and again. There's obviously a time limit of 6 months between each donation. Remember, the important thing here is you want to make sure that these volunteers are retained. You want to encourage them to come back again after 6 months and donate blood again to save more lives. When it comes to pre-donation counseling, you have to make sure that this person has adequate knowledge about what they're doing. The volunteer should be told about the modes of transmission of different diseases like HIV, hepatitis, syphilis and all. You want to make sure that they understand well that they're not at risk and they're not putting someone else at risk by donating their blood. You also want to talk to them about risky behaviors. What behaviors can actually help in transmission of such diseases that they might have participated in or might have not. And even you have to also make sure that these volunteers are well informed about the prevention interventions they can take. Let's say use of condoms or any other preventions that we have seen for HIV transmission. These preventions will help them be more eligible to donate blood in the subsequent periods of time. So you need to make sure that these people are well aware of what they're doing and also provide them a safe way out in case they want to exclude themselves from the procedure of donating blood. You want to make sure that they're not being harassed, because sometimes in medical camps those who don't have knowledge end up harassing volunteers that they have come in, they have understood everything, we have explained them everything, but they have still denied to donate blood. So this should not be done, and patient safety is at most important, but also donor safety is at most important in terms of blood donation. Let's say a patient has understood all the information you have provided as a healthcare worker about donating blood. They're comfortable with it, they have not been persuaded to donate blood, they are aware of what they're doing and they're volunteered to do so. In this case, you have to also assess clinically if they're suitable to donate blood or not. You want to make sure that they're not at risk of other diseases that can intensify or aggravate because of donating blood. And you want to further screen these volunteers to make sure that they're overall healthy and they're eligible to donate blood on a regular basis. Once the volunteer has donated blood, the packets of donated blood are taken to blood bank. Here, they're screened routinely for hepatitis B and C, syphilis and HIV. Make sure that this screening that's done is adequate and thorough, error-free, to avoid any chances of infection. That's why once the screening is done, you have this blood coming to you at the hospital. You can be certain that this blood does not have any sources of infection. Meanwhile, what happens to the donors? Remember, the donors gave you blood. You have taken the blood to the blood bank. After it's being screened, you need to make sure that in case the blood turns out to be positive for HIV, syphilis, or hepatitis B or C, you want to make sure that these donors are informed immediately so that they can be referred to the appropriate care and management centers. So far we have seen how the volunteer donates blood at a blood donation camp, and then how the blood is taken to a blood bank, tested adequately and brought to the hospital. What do we do from there? As healthcare workers, we need to make sure that we assess patients thoroughly and test them adequately to have an order of priority to who should receive blood first. After prioritizing the patients, you need to make sure that you have tested this blood along with the patient's blood for ABO histocompatibility. You need to make sure that patient receives a blood that matches their blood type or a blood that is safe for their blood type to avoid any transfusion reactions. It might be major or minor. So after having assured that you have matched the blood, you need to administer this blood to the patient, and upon doing so, you have to monitor them adequately for any complications that might arise. If any complications happen, you need to make sure that the patient is managed appropriately. Saving someone's life through donating blood is essential, but what's more important is that you give them safe blood. You don't want them to end up with another disease just because of transfusing blood trying to save their life. Thank you for watching. If you enjoyed this video, please give it a thumbs up and share it with your friends. You can also subscribe to our channel for more great content. And don't forget to follow us on Instagram, Twitter, Facebook and TikTok.